Ali Gabo and Harrison Kalu have a lot of ground to cover today. They head up Safari Doctors, a locally run organisation trying to improve access to medical care in some of the most remote parts of Lamu County. It's an unforgiving environment. Wild animals stalk the roads and there are reports of Al-Shabaab militants camping out in the surrounding forest. We visit several villages belonging to the indigenous aware community. Water scarcity and a lack of medical assistance are major problems here. Today, Safari Doctors want to focus on two serious health concerns. Jiggerworm is first, a parasite that burrows into its victims' hands and feet.
This one is the worst case because it has affected the fingers, the toes, knees. It was left for a longer time. It was neglected. Parents did not bother to remove.
The communities that we've passed through are not only remote and difficult to reach, but they're also very close to the border with Somalia, which means it's a high-risk area to travel in. And if it weren't for the work of nurses like Kalu and Ali, these communities probably wouldn't have any access to basic medical care.
We are very grateful to Safari Doctors who have seen how they're helping to improve our well-being and health, and they'll continue to help us.
Ali checks on a woman who gave birth a few days ago. The baby is in good health, but the new mother is complaining of severe abdominal pain.
The mother she might have developed sepsis or something like that. So Mr. Kalu, who is our nurse in Mangai, will send some capsule amoxicillin together some painkillers so that they can be able to sustain themselves because there's not much food here.
A lack of pre- and antenatal care is a huge problem here. Finding transport to the nearest medical facility if a woman develops complications during labour can be the difference between life and death. An important part of their work introduced by Kenya's Ministry of Health is the training up of community health workers to be eyes and ears on the ground. There are 20 among the 5 different villages.
My work is to educate the community about personal hygiene, taking care of our environment, a healthy diet, and helping them understand diseases like malaria, which affect young children and pregnant women.
Before we leave, a young woman and baby with fever are helped into the vehicle. Kalu will examine them at the nearest clinic. Here, even basic care can save lives.
I've grown in a way of loving assisting people who are sick. I did nursing, and then the nursing went deep into my blood. So I feel somebody sick, and if I'm there to assist, then I have no objection. I have to do it.
Safari Doctors knows it doesn't have time to waste in trying to meet the needs of this community. But improving access to medical care here requires more resources and support from the government. This would make a huge difference to the lives of the aware and its future generation. Clementine, Logan, CCTV, Mairani, Kenya.